CS Medica is a Danish company developing cosmetics and medical products with cannabis. In September, the company will go public on Spotlight, and today we're going to talk to CEO Lone Henriksen. Warm welcome, Lone.
Thank you so much, Adam. I'm pleased to be here.
Can you start by telling us a bit about the company and your products?
Absolutely. CS Medica is a Danish medical growth company where we utilize the cannabinoids from cannabis to develop treatments for pain relief, autoimmune and stress-related illnesses. We were founded in 2011 and we have 9 employees as of today. The operations are run through 2 subsidiaries, Galaxa Pharma, which is registered as a medical device and cosmetic distributor, and Can Nordic, which is registered as a medical device and cosmetic developer and manufacturer. During the years we were developing our products, we developed a product information system where our distributors can retrieve all product data related information and marketing material. This is to ensure a fast rollout. Furthermore, we have developed our clinical trial system, online trial system, where we can run post-marketing clinical trials with organizations, and our distributors can do that locally in their own market. Furthermore, we found ourselves in a position where we needed to educate people to understand more about the cannabinoids and the properties toward different diseases. The products we have today is 2 product lines. We have a cosmetic line, which we will introduce to the market in late 2022, and a treatment line, which we are currently focusing on, where we have 6 medical device products. All of these products are manufactured with CBD from the legal hemp plant Cannabis sativa L, which is registered in the European catalogue. And the products are optimized with the best body availability of the CBD, as we found that delivering CBD orally, like for example what we see often on the market, the CBD oil, do have a very low bioavailability for the body, around 6 to 15. But furthermore, it do have medical interactions with other medicines, and this is due to the first pass in the liver. Whereas delivering the CBD via the skin or the nose, you do not have the medical interaction, but you also have a much higher bioavailability. Through the skin, it's around 45%, and through the nose, it's around 40 to 45%.
Now, the global market for cannabis products is estimated at around $5 trillion. How much of that is addressable for you and your products?
Well, the $5 trillion market is including the industrial, the marijuana market, and our market is the CBD market, which was estimated to $1.9 billion globally in 2018. And they were forecasted with a growth rate until 2024 to reach 49%. Which give a forecasted market of $20 billion in 2024.
Now, in terms of competition and competitive advantages, what distinguishes you from the competition?
Well, our product is registered as a medical device, and as far as we know, we are the only one with a medical device on the market, which give the customers security of the efficacy and the safety of the products. Furthermore, the legislation around medical device changed this year in May from the former regulation MDD to the new one MDR, which is much more strict and very similar to the FDA regulation. Our products was registered as a class 1 under MDD. Under MDR, they will be moved to a class 2A. And in order to get on the market under the class 2A, you need to perform the clinical trial, and you have to go through an application process with notified body, which takes 2 to 3 years, we estimate, whereas we were already on the market under MDD, we can stay on the market. This gives us a window of advantage of 2 to 3 years where we can stay alone on the market.
Now you expect to reach 7 million Danish crowns in revenue this year, and your target is to reach 150 million Danish crowns within 3 years. What are the most important things that need to materialize for this to happen?
Well, first of all, we need to utilize this window we have where we are alone on the market. That means we have to have a fast rollout in Europe and in United States. And this is done through our platforms, the product information platform, and also to share our knowledge with the public in order to educate them in this field.
If we stay in the income statement, what kind of profitability are we talking about with this kind of product?
Well, we are operating with a gross profit of 67% and a net profit of 12%. This is due to we have a very high cost in marketing in order to secure our fast rollout.
Now you are raising 33 million in a unit issue before the IPO. How will you spend that money?
Again, it's the market penetration in Europe. It is continuing our R&D and clinical trials. It's finalizing our portals, and of course, then it's also initiate our FDA approval in United States. This means we need to start sourcing for partners, both as legal representative, manufacturer of our products, and then not least raw material in the United States. And of course, continue on our patents to get our final approval.
Last but not least, what do you consider to be the most risks?
We have two main risks as we see it. There is COVID-19, where if we go into a total lockdown again, where retailers are closed, the partners we are looking for do not have customers in the other end. That means that they will be reluctant to take in new product lines into the market, but will focus on their current business. But with the vaccine program and the forecast we have just lately heard is that the likelihood of a total lockdown should not be as a high risk. And then of course there is the demand, the price and the competition. As the increased demand for CBD products is ongoing, we see that there will come more manufacturers into the market, and that might push the prices of raw material up. But as we are the first mover of medical device and we have 2 to 3 years alone on the market, we see ourselves to be in a position where we can establish ourselves as the manufacturer of medical device on the market.
Thank you very much for being with us today, Lone, and good luck with the IPO.
Thank you so much, Adam.